Good afternoon. I'm Dr. Alex Samuel, Health Director for the Chesterfield Health District. I wanted to provide an update on the COVID-19 situation in Chesterfield County today. Over the past 2 weeks or so, we've noticed a sustained increase in the number of daily new cases from an average of around 35 new cases a day about 2 weeks ago to around 45 new cases a day more recently. This upward trend in cases is occurring throughout the greater Richmond metro area, which could be indicative of an actual surge in cases. Hospitalization counts for COVID patients have ticked upwards in Chesterfield County, but a stronger indicator that hospitalization numbers have increased is that they have done so slightly throughout the VDH central region, which is a fairly large geographic space. And that better captures hospitalization use. Both of these metrics, new cases per day and hospitalizations, are reasonably strong indication that we're seeing an actual increase in cases due to transmission. In other words, we're not seeing more new cases only because of increased testing. Death counts are not a reliable indicator because of the way that data is recorded. For those of you who follow data on the VDH website, especially death counts and hospitalizations and cases, there are 11 deaths recorded in Chesterfield County since July 24th. Only 3 of those deaths actually occurred between now and July 24th. The rest occurred sporadically going back to early June. Death counts can be added from death certificate data that sometimes takes several weeks to occasionally a few months to get processed. So with all of this, I want to remind everyone that the only weapons that we have at this time might be crude, and they're simply the same things that we keep talking about, which is to establish distance and put up a barrier, which is a face covering. These are the fundamentals, and sometimes it's important to return to fundamentals. Which is critical when we see an increase in cases. These measures work, will continue to work. They've been tried and tested when we had the shutdown, as well as in other parts of the world. It's absolutely important that we continue to practice them. So just kind of review, these include hand washing and surface cleaning. The coronavirus is a relatively weak virus, although highly contagious. Early research indicated that SARS-CoV-2, which is the virus that causes COVID-19, can be eliminated from hands and other surfaces simply with thorough washing with soap. This is hand washing, good hand washing for about 20 seconds. The simple truth is that washing your hands greatly reduces the chance of transferring the virus from your hands to a part of your body that is a vulnerable point of exposure, like your eyes, nose, and mouth. This underscores why we are urged to not touch our faces. In the absence of access to soap and water, a hand sanitizer is a reasonable alternative, although using soap and water is better. Social distancing, of course, is a measure that we talk about a lot. Scientists studying COVID-19 recognize that the virus does not easily travel very far in the air because it's transmitted in small packets of mucus and saliva known as respiratory droplets. These droplets are typically too heavy to travel very far, with a generally accepted travel distance of around 6 feet when somebody coughs or sneezes, hence the 6-foot social distancing guide. That is why we are advised to also cover our coughs and sneezes to reduce the distance these droplets can travel. Generally speaking, staying 6 feet or more away from others will prevent you from picking up any droplets that others might be shedding or spreading. This brings us to wearing a face covering, which is absolutely critical because it creates a barrier for transmission. The important point here is that research shows that people can be infected with the virus and not show symptoms. Wearing a face covering protects others from those who might be infectious, but simply don't know that they are infectious. This can include you, it can include me, hence the reason face masks have become a part of our daily lives. So all of these things, these fundamentals, things that we should be practicing every day, play into the broader mitigation efforts being undertaken by our community at large. Executive Order 63 requires Virginians to wear face coverings while inside of most private businesses and public buildings. More recently, most large retail establishments have adopted face covering policies for employees. These companies are also requiring the use of face coverings for nearly all patrons, with the exception of those who have certain underlying medical conditions. This practice underscores the awareness by retailers of the sensible and effective mitigation strategies outlined already. Other restrictions are in place to distance people in restaurants and other social and congregate settings. So in concert with these policies, most companies are now using 6 feet social distancing markings on their floors to remind customers of the need to put more space between themselves and other patrons. In addition, where these distances cannot be maintained, plexiglass barriers have been installed, primarily between customers and clerks, to protect each from the other. Both government and corporate entities are also taking part in an ever-increasing campaign to provide masks and face coverings to those in communities of need by distributing free masks through nonprofit organizations and other community initiatives. While we are all understandably very weary of COVID-19 and the way it's impacting our normal lives, we must realize that where we ourselves are where the buck stops when it comes to limiting the spread of the virus. Our behaviors are driving its spread. As things open up, we need to be mindful that increasing opportunities to come into closer contact with others increases the risk of spreading this virus, especially when effective barriers like face coverings are not used. The trending upward in cases in this county, in the region in general, is something that we should all pay attention to and do our parts to reverse. Again, our health is truly in our hands. Thank you.